As the flu season progresses, I introduce myself to the patients and advise them that we have 3 entities going on in the county. I advise them that you cannot treat a viral entity with an antibiotic unless there's other complications. Viruses will not respond to antibiotics. If we do a blood count and we indicate that your blood count is going toward the upper end of the scale of what we consider normal, then we consider antibiotic therapy. Otherwise, we treat the symptoms that the patient is having. If you're having extensive cough, we'll give you cough medication. If you're running fever, we treat the fever. So we try to make the patient as comfortable as possible, yet let them know that every entity does not require antibiotic therapy. And it's hard for a mom to want to take her child home still running a fever and not have an antibiotic. I think we as adults have gotten to the point in life where we feel an antibiotic is what you need. We're trying to get away from antibiotic therapy when we can. If you're running high fevers, you have the aches and the pain, joints hurt, you don't want to be around anybody. It hurts when somebody talks loud. You just feel bad. If you have those symptoms, it doesn't necessarily mean that you have the flu, but you have flu-like symptoms. We have a rapid test here in the clinic that takes 5 minutes, and we do a nasal swab, do the test, and if you have the flu, it generally will show up. As with all tests, there's possibilities of getting false negative, false positive. But if we feel by our experience that you have the symptoms and you have a positive flu test, then we will initiate the appropriate medication, whether it be just Tylenol, Motrin, hydration, or a new medication, which is an antiviral called Tamiflu. I'm sure all of us have heard about Tamiflu.